back to FKB Physio podcast. For anyone watching online, obviously this is, I guess, not just a podcast. This is episode 12 of today, and I've got Helen Beeley with me. So Helen and I did an Instagram live last year, I guess, and Helen reached out and wanted to repeat it with new information and renewed vigour. So what better way to do it with a higher quality mic than repeat the whole experience and to a higher standard in 2023. So for those listeners that don't know you, Helen, do you want to just tell them a little bit about your background?
Oh, hello. I'm Helen Beeley. I'm a physiotherapist. I've been a physio for about 28 years.
So cool.
I've worked in a range of areas, starting off in musk, sports, occupational health, and then I moved into pulmonary rehab, inpatient geri rehab, cancer care, palliative care. And currently I have an awesome job. I work in an over 50s clinic. We have 9 consult rooms. We have 2 gyms and a 3rd exercise space. And I work with a great team of exercise physiologists and physio.
At UQ?
At UQ Healthy Living in Toowong. Yeah.
So awesome.
Yeah.
I've actually told people about that place, just kind of like promoting that they go there. So that's so great. And I guess the reason I have you on today is to talk about exercise medicine in cancer. Is that right? Cancer exercise medicine?
Yes, absolutely.
And I suppose you come at this with some personal experience. So do you want to just talk a little bit about that?
Yes. So I had breast cancer in 2020. Mm-hmm. I was diagnosed at the start of lockdown, but because of my background and experience in cancer care, I knew that I needed to exercise. So I had taken up powerlifting about 9 months before I got cancer, which was probably the best thing to do, because I built some muscle mass. I actually gained 5 kilograms. And there's evidence showing people with a higher muscle mass have less toxicity, less complications from cancer treatments, and also less complications from surgery, and also less morbidity and mortality. So muscles are really, really crucial in cancer care. But it's one thing it was a different experience being on the other side, because it was the hardest thing I have ever done. And that was with my knowledge of knowing that it was safe, that it was a crucial part of treatment. I continued with my powerlifting coach. She just, I gave her some information, but she decided not to believe me and went and checked with her physio. But she was just amazing. Like she went, I could tell that she'd been doing some extra reading, because she started throwing in, lingo like, fatigue management, things like that.
So what are the guidelines? Let's say for someone who's undergoing chemotherapy treatment, what are the guidelines for exercise?
Okay, well, we'll step back right to the very second you were diagnosed. So just before I launch in, just terminology, I'm going to use the terminology cancer survivor, which is medical term, just means that you've been diagnosed with cancer. Okay. So the second you're diagnosed with cancer to the day you die, you are classified as a cancer survivor. Some people in the cancer community don't like that term because they think like, I'm a survivor. But no, to me, it's just a medical term. Anyway, so Australia was the first country to launch a position statement on exercise in 2018, saying that exercise should be embedded as a part of standard cancer care, because of the reduction in side effects from cancer and its treatments. And it's pretty much like the general population health guidelines, which is avoid physical inactivity and then work towards and maintain both aerobic and resistance training. Aerobic is 150 minutes per week of moderate intense aerobic training, or 75 minutes per week of vigorous. And then the resistance training is 2 to 3 sessions per week of moderate to vigorous intensity training. Okay, for some reason in my head I have 300 minutes, or is that if it's like low intensity? I think I just could have got it wrong, to be honest. I think it in my mind. I probably got it wrong in our Instagram live. I think I probably went straight to the public health guidelines. So, but there's a lot of work being done in the space to refine it more to the individual cancers, and then in terms of exercise prescription and different elements. So there are different guidelines for, say, bone density versus fatigue, etc. But at this point, it's work towards and then maintain.
Yeah, and so I guess like you say, there's consistent elements across all of them. In that, like resistance training, for example, is always in there. The 2 days a week of that.
Yes.
And you've got some very impressive footage of you, like in the middle of your treatment, I suppose. Yep. Keeping up your strength training.
Yes.
I think it is so powerful to see it, because I remember at uni, I'm sure we got taught that you weren't really meant to exercise if you had a cancer diagnosis or there were specific contraindications. So what's the things you need to look out for?
Yeah.
What are the contraindications?
Okay, I'll just start with, I think that is a general perception that people hear cancer, either fitness professionals or health professionals, and they run away screaming with fear. But if we look at fear, you should be more scared about not promoting cancer exercise. So back in 2018, Professor Prue Cormie, she's an exercise physiologist and a cancer exercise researcher. She stated back in 2018 that the evidence for exercise is so strong, it's probably harmful not to, promote cancer exercise medicine. And that was back in 2018. And so now we've had more and more research. And recently I was speaking to Professor Rob Newton, who is another exercise physiologist and cancer exercise researcher. And he was saying it's not a thing that's nice to do.
Yeah.
It's a must do. And he spoke about the tumour suppressing qualities of exercise. So not only does exercise work synergistically to get more of the chemo and radiation actually into the tumours, your body exercise will unleash your immune system to help suppress cancer. So exercise is not a cure for cancer, but it's a medicine that works with your other cancer treatments. So we really need to have this exercise is medicine mindset. If we look at the Australian guidelines, they're saying all members of the health team should encourage exercise. And we even had ASCA, so the American Society of Clinical Oncology, who seem to be a little bit more conservative. They finally came out last year and said all oncology providers should, they didn't say it was nice, they should promote aerobic and resistance training to people going through active treatment. So I've forgotten what your question was.
No, you just answered it. It was really,
So I think we need to be, very strongly promoting exercise, and the research is showing that it is, it's safe, and there's very few contraindications. So clearly, if someone's got fever or an infection, you're not going to exercise, and then it's just your general risk assessment. Like if you had anyone with cardiac or pulmonary disease, you're just going through just your general cardiac risk type assessment. There are guidelines around, if your neutrophils are really low, well, you want to be clean because you're immunocompromised. Even if you've got, quite significant anemia, you can still exercise, although you will be more breathless and fatigued. So that's where things like, cluster sets, increased time resting between sets, low platelets, well, don't fall over, don't drop things on your feet, just kind of common sense thing, because then the fear there is a risk of big bleed. And of course, you follow surgeon's guidelines. So, if you need to get that wound healing or whatever healing happening. So there's not really a lot of contraindications. There's a really good article I should let you have, I'll send to you for the show notes. It was a Lancet article that was published, a couple of years ago. And it made me laugh out loud because it was going through the contraindications, and one of them said, the patient must not exercise if they're unconscious.
Oh, God.
Or they're having an acute MI. I'm like, did you really? Yeah.
That's just,
So, Francis, if they're unconscious, no.
Okay, good. Thanks for clarifying that one.
But of course, you do need to be, sensible, and keep in mind that chemo and radiation impacts your heart and your lungs.
Yeah.
If you've had surgery, it's just back to your basic principles of, physios know.
Yeah.
They know if you've got someone who's very deconditioned that you start off here and you gradually progress them.
Yeah.
Autoregulation's really useful in cancer. So it might be that your exercise prescription is different. So for example, the first chemo I had, AC, nicknamed the Red Devil, I had it every 2 weeks because I was considered very young.
Oh, yeah.
So older adults might have it every 3 weeks.
Okay.
But you just feel pretty knocked out the first, 3 to 7 days.
Yeah.
So you do less that week. But then on the second week, I could do more. So it's not like you're rigid with your exercise prescriptions. You do have to take into account, fatigue and other symptoms.
Yeah, because I noticed something you talk about in your socials a lot was like fatigue and maybe nausea.
Yes.
Back like when those were big problems. So how do you, if I have a patient who doesn't like exercise anyway, and they're now feeling terrible, and we're telling them to exercise, I feel like in those situations I can't relate at all. Because I'm like, I have literally no idea how you feel.
Yeah,
so
that's right.
How do you motivate them to do it?
I can talk about how I'm motivated and how I motivated other people. So, there's strong evidence that exercise reduces side effects like fatigue, anxiety, and depression.
Okay, massive.
Yeah, that is strong. What actually motivated me was I watched this 2016 documentary. It was Catalyst. It had Professor Rob Newton in it. And in it, he spoke about this mouse study. So they had mice with various types of cancer and they randomised them. One lot of mice did nothing and the other ran on an exercise wheel whenever they wanted to.
Yeah.
And then they autopsied them and had a look at the tumours. And the tumours in the exercising mice were at least 60% smaller than the other group. So I think saying it or reading it is not as powerful as that photo.
Yeah.
So when I felt really, really lousy, I would look at that photo because to me, when you feel rubbish, saying, this is going to make you feel better and it's going to reduce your fatigue, whatever.
Yeah.
But it's like this could potentially reduce your tumours even more.
Massive.
That is way more motivating because you are motivated to live.
Yeah,
that's,
for sure.
The majority of people diagnosed with cancer really, really want to live.
For sure.
So, and the other thing is, it's really getting into that mindset. So I never woke up and went, oh gosh, I want to go to chemo. I'm so motivated to go to chemo, or I'm so motivated to go to radiation. And I never said, I'm too tired. I'm too tired to go to chemo today. I'm too tired to go to radiation. So you need to put that same mindset to exercise as well. So, And I recently, even just last week, I had someone who'd been referred and this person was told by their oncologist that they have to do prehab before their surgery because they're going to have surgery and then, chemo radiation. So I whipped out the mouse.
Yeah, awesome.
I whipped out the the mouse photo because before then he had been a bit like, I work really long hours and blah blah blah, and I went through all the side effects.
Yes.
Yeah. And then I pulled out the mouse, and he said, "Oh, okay, I've got to do this."
Yeah.
Yeah.
I can see that.
Yes, and I've got a nickname for my weeks where I feel really fatigued and don't want to exercise. I've called it "I'm having a mouse week."
Yeah.
And that's where the only thing, nothing will motivate me to exercise except for visualizing the mouse. And because there's a strong body of evidence that people who exercise, especially the more you exercise and the higher intensities, you have a greater reduction in your risk recurrence. So I mean, I'm not
Amazing.
I'm not 100% in control
No,
of my cancer.
of course.
If it comes back, it's not my fault.
No.
It's a really sucky disease.
Yeah.
But I'm doing everything I can to reduce my risk of recurrence. So
Yeah.
So anyway, I was talking at work to some colleagues, going, I'm having a real mouse week.
But that's so powerful. I think
This week.
I can see that as being really
Yes.
powerful motivated. And I guess just from my side, I suppose, I talk about like bone density stuff and everything. And I guess I think that is really key as well, to know that a lot of the chemotherapy medications are quite bad for bone density
Yes.
and muscle mass loss.
Yes.
And so it's sort of like, I have a lot of clients, actually, a lot of women who are young,
Yes.
young, 50s, who have had cancer in the past, cancer survivors. They've had their treatment, now they have osteoporosis in their 50s already.
Yes.
Maybe the medication, but also they might have had early menopause because of certain, whatever treatments they've had, whatever
Yes.
it is. And so they need to look at their bone density now. And some of them have said, oh God, I wish someone told me this back then, because I would have started then. So there's always like other benefits as well as just the huge ones you've said. There's
Yes.
also the bone density maintenance.
Absolutely. And you're bringing up a really, really good point. I get messages all the time from people, like cancer survivors, who are, I don't want to swear, but they are furious. Like, they are so furious that they were not told about exercise. And I think, well, yeah, maybe I could have preserved my bone density. Maybe I would have had less side effects. So, and then what's even more frustrating is you get this absolute out-of-date health professionals. Like, one person said their oncologist told them they were foolish. So this was in America. So, and I'm not saying all American oncologists are like this. I'm just saying this particular person was from America. And their oncologist told them that they were foolish for continuing exercise during chemo. And I'm like, but we have guidelines saying that you should be promoting this. It might be foolish if you weren't following surgeons' guidelines. You'd be, the wound hadn't healed, but So, and then since we spoke last, there's just been an absolute explosion in cancer exercise research.
Awesome.
The research is now looking at, what's the best timing to help enhance your chemo and radiation. And there's even research, like I told you last time, that in some parts of Australia, there's a gym co-located in the cancer centre where people will have their chemo or radiation and then go straight for their supervised exercise, supervised by an exercise physiologist. So that's been going on in parts of Australia for at least 6-7 years. But now people are sitting on an exercise bike while the chemo is dripping into their veins. So the safety and feasibility studies have been done. So it's safe. It's safe, and the nurses could carry out their cares. And now it's just looking at what impacts does this have?
Wow.
Are we getting more tumor? Are we getting more of the drug into the tumors? Are we having further shrinkage? And apart from anything, it's at least helping people hit their 150 minutes per week. Because some people are, some of my chemo days, I was there for 6-7 hours. So I would just walk my IV pole up and down. But so I love it. We have a lot of like adolescent and young adult cancer patients who film their dances for their TikTok and their reels. I'm like, physio approved.
That's really cool. And I guess
do that.
The thing is, like, if it's coming from the doctors, like and I know that people will do it if a doctor says it. So, like,
absolutely.
I'm glad to hear that there's all that stuff happening, because it makes me think they'll start prescribing it, like they prescribe the chemo.
There's real pockets of it. So my oncologist basically said, I'm really sorry. Like, if you were in Western Australia, you'd be going straight to the gym, and I'm so sorry that we can't offer that there. But you need to exercise so that you get more medicine. You need to exercise so you get more chemo and radiation into your tumours, and for all the other benefits.
Amazing. Well, that's good you had that experience.
Yes. But then I've got, someone I met on the Gold Coast who was told nothing.
Yeah, it's a mixed bag. who have stage 4 cancer, which I'm going to be the first to admit, I don't know what that means.
Okay, all right.
Please tell me.
So, well, there's stage 1, 2, 3, and 4. So stage 4 cancer is not a homogenous group. You have ranging from stage 4 cancer. So that's where, well, it depends on the cancer type. I'll just talk more the ones that are the tumour types. It's where it's spread beyond lymph nodes and into other parts of the body. So stage 4, by definition, is a chronic lifelong disease.
Yeah.
So you've got stage 4 with no evidence of disease, through to stage 4 who are nearing the end of life.
Right.
And they're often, sadly, a forgotten group.
Okay.
But the thing with stage, because I've worked in palliative care and I've worked with stage 4 cancers across the spectrum, cancer survivors across the spectrum, they're not just sitting staring at a wall waiting to die.
Yeah.
They actually are people with goals who want to do stuff.
Yeah.
So for your stage 4 cancer survivors with no evidence of disease, it's just the usual exercise guidelines that we've discussed.
Yeah.
For those with bony metastases, an international position statement came out in the last year or two, and that's where you need your physio or exercise physiologist to be working with the oncology team, so you know where the bony mets are.
Right.
Yeah, and then, I mean, you know, if someone's got bony mets in their pelvis and legs, you're not going to tell them to jump up and down.
Yeah.
Because they could end up with a pathological fracture.
Yeah.
But yeah, you can still do strength training and aerobic training. You just need to, you know, respect pain.
Yeah.
And, you know, kind of a generally-ish rule is you wouldn't exercise the joint proximal to where the tumour is. So if you've got like a tumour in your femur, it's and this is not advice. Like, go see your
for sure.
go see your health professional. But generally, like that, they could do like a knee extension and a knee flexion.
Right.
But you wouldn't get them squatting.
Okay.
Yeah, you wouldn't get them squatting. But there, and again, there's evidence. You know, there's research that's been done in people with spinal metastases, and the exercise gives them pain relief apart from anything else. Yeah. And then it will just enable people to go about their lives and do what they want to do. So, like, I know people who are stage 4 with, you know, the bony mets, and they've got young children and they want to look after their children and they want to make memories as well.
Yeah.
So,
definitely.
yeah. And then we've got stage 4 nearing the end of life. Well, then that comes down to the individual, you know, whether they want to exercise, and you don't want the exercise to be a burden on them, because normally nearing end of life there's a lot of fatigue. But I've had friends that sadly died who were exercising up to, you know, 3-4 days before they died, and for them it was pain relief, but it was also about mental health. It was gave them those, you know, mental health benefits and a feeling of control. So, because you mentioned pain relief a fair few times, and I guess this is funny, because of the type of physio I am, where I just do exercise with people mostly, and I focus on function and I suppose coping with pain. I actually panic at the phrase pain management. When I hear someone say physios can help with pain management, my brain goes to massage and hot packs, because that's what it has historically meant in like nursing homes and stuff. So can you, because I literally, when you say that phrase, I'm like, oh god, I can't do that, because like I don't know how anymore, because I don't practice that way. So what do you, but I know you think like me, so I'm like, all right, what do you mean? Okay, I'll just give you a very clear, you know, pain management, a very, very clear example. So during chemo and radiation, you have got systemic inflammation. So, and that inflammation just gives you joint pain everywhere. Right?
Awful.
But I'm a physio. I'd wake up in the morning, like back pain, knee pain, hip pain. But because I'm a physio, I'd be like, this is inflammation, you've got to get up and move. And you know you're going to feel better in 5 minutes. But the first few minutes are just like, oh. That is pain management, having that knowledge. Because a lot of people would think, oh, it must be dangerous for me to exercise. So just imparting the reason that you're in so much pain and have joint pain everywhere is inflammation, and, you know, your muscles help moderate. You know, muscles are not just things that look cool. They actually help, you know, they've got a metabolic role, and they help reduce that, you know, that inflammation in people going through that. So that's part of it. Another part that you would know. So
This is exactly the problem. I undercut, the things that they sound so obvious to me.
Yes.
And I think I give them different labels.
Yeah.
But no, that's good to know.
That is pain. Yeah. I mean, that's pain management.
Yeah.
So another thing is, I mean, it's a very small group, but I've heard this happen over and over again, and it kind of happened to me too. But people will think they've had a recurrence of their cancer, and they'll have the scans, and then the oncologist will say, "Oh, good news! It's not a cancer recurrence, but you've got a disc bulge and disc degeneration."
Oh God, no.
Yeah, and so then a friend of mine was really upset. She's like, "Oh, I'm only 30. I've been put in menopause, and I've got this disc degeneration, and so I'm destined to have back pain for the rest of my life." So you know, yeah. So it's like, and you know how to handle that. You're all over that. So that again, that's pain management. That education. That your scans are not destiny.
Yeah. Okay. That's good to know.
That's right. And then all the exercise. You know, your general principles of exercise. So
because I do think, I guess the way is, I guess it's a contentious topic whether exercise is good for pain relief or not. But I suppose I know a lot of the time with my patients who have pain, we do exercise and then they feel better at the end of the session anyway.
Yes.
So I know that it can have that sort of immediate effect. And I guess we don't 100% know why. It could be lots of different things.
Yes.
But I suppose there's also the power in going, oh, well, I have pain, but I still did these things today. Yeah. Maybe it mustn't actually indicate something really serious is wrong. And so you can help reframe what that pain means to you. And I suppose I do find that super helpful. So I guess you're saying that can help for people in cancer recovery as well.
Yeah. Well, we've got those physiological reasons with the inflammation. So
the inflammation. Yeah, and I guess because exercise does help reduce widespread inflammation as well. Correct?
Yes.
Yeah. So that's all great.
Yeah.
I just wanted to ask a couple of specific questions about some things that come up with people in this population. So lymphedema. Yep. So again, it's something I sort of panic a little bit about because I just have had basically no experience with it. So what are the considerations with lymphedema and exercise then?
Yep. Okay. Well, I'll talk about breast first, then remind me to talk about other.
Yeah.
But so we've got studies going back 15 years showing that resistance training reduces your risk of getting lymphedema.
Wow.
Someone who's had lymph nodes removed is always going to be at a lifelong risk of lymphedema. But the key messages are you want to use the limb normally, and progressive resistance training. So you start low, monitor for signs and symptoms, and progress as you go along. So, and the key is to identify it early and get people off to a lymphedema therapist, because if it's caught early, it is reversible.
Okay, cool.
So so I was a lymphedema therapist in a previous job.
Yes.
Yeah.
Is that, so because I'm just thinking of someone I know, a massage therapist who trains in lymphedema management, is that a lymphedema therapist, or you need is it a doctor? What is it?
I'd go to the Australian Lymphology Association. Okay. It was quite an extensive. It was about 30 hours of theory and exam online, and then we met. Forgotten. I think it was 4 days face to face. So, but you need to be like a ALA, Australian Lymphology Association certified lymphedema therapist, because we've got the problem that all the bog standard advertising for massage therapists is they call it lymphatic massage. It's like, well, but you're not a lymphedema therapist. Okay. It is. I mean, technically, I guess all massage, provided you're going towards centrally, is all, I guess, draining, lymphatic stuff. But the problem we've got is that people are still getting really awful, out-of-date advice from oncology providers. Things like, don't lift up your baby. That is absolute nonsense. So an international consensus statement came out last year, and it's basically saying key message is encourage normal use of the limb.
Yeah.
Resistance training is not contraindicated, and in fact is protective, provided that you do it in that, start low, progress slow manner.
What about lower limb?
Lower limb. There's not as much research that has been done, but
Same thing.
I'll just refresh. Do you want me to refresh you on the lymphatic system?
Sure.
Okay, so you got your I'll just do a cardiovascular system. You got your heart that pumps the blood around your body. So it's got a pump, And then the stuff you got the arteries and the arterioles, it all leaks out, gives all the good stuff to the capillaries and all that. And then it goes back in via the venules and then the veins.
Okay.
But then the stuff that's too big, is carried back by the lymphatic system.
Yes.
So, proteins, debris, things like that. But the lymphatic system itself doesn't have a pump like the heart.
Yes.
So the only thing is your muscles.
That's
your
right.
muscles are pumping, lymphatic fluid around. So that's why you want people to get moving.
Yeah.
And, you do your first aid training every...
Yeah.
Yeah. Well, treatment for a snake bite, snake venom travels via the lymphatic system. So it's the opposite. You lie very still and you don't move because you don't want and you wait for help. So, yeah. So to be giving people this message that they should be fearful is actually, it's harmful and it's the opposite of evidence. And I guess for me, it's just really frustrating when we got this evidence that's 15 years old, 14 years old. So,
across the board. I feel like I have this conversation with patients every single day when they're kind of, I shouldn't be doing that. And I'm like, it's actually more dangerous not to.
Yeah.
And I think it's important to say for anyone listening that doesn't work in health, that the evidence Helen's talking about, it's not like it's, because I think a lot of the time people go, oh yes, but of course you think that, you're a physio, but whenever it's a consensus statement, it's experts in the field. So it's not just physios, it'll be the oncologists and everyone. And it is funny when you look up those guidelines, like if you look up GP guidelines and these oncology guidelines, they're medical, like as in doctors use these too. Yeah. They actually all say the stuff we're saying. And you read it and you think, I'm confused because these guidelines that are for doctors are saying what I'm saying, but the doctors aren't saying it and I am. Like it's weird. It's not all of them, of course, but it is weird. Exercise it's just still seen as risky, especially hard exercise. I'm like, I guess I wanted to reiterate as well that when you were exercising, you were doing hard. It was hard. Didn't you do like a 1RM in the middle of...
Yes, but it's important to recognise. So I got diagnosed. I had my mastectomy first. Yeah. And then I had to follow surgeon's guidelines. Right, true. So I couldn't... Yeah. So she at the time said, 3 to 4 weeks, whatever you think. I'm like, well, of course, I'm a physio. I'm going to... Yeah. 3 to 4 weeks means 3 weeks. And so... But I'd had a full axillary lymph node clearance. So then, so when I started training, I started with 1.25 kilo plates because we were in lockdown, and that was the smallest weight I had. Yeah. So even though probably 6 weeks before I had been repping, 45 kilo bench press. Yeah. And a month had passed, I didn't go back to that. I started literally with 1.25. Yeah. And then, progressed very slowly. And then I had the 2.5 plates. So it was a very slow progression with checking, in between. Yeah. And I self-referred to a lymphedema therapist. Right. So what these international guidelines say is that people should be given education on the first day after their surgery, including written materials, which I don't think happens everywhere. Yeah, because I can't possibly cover in this podcast all this, all the whole lymphatic system, because you need to have other understanding of anything that any trauma, infection is going to increase the work of your lymphatic system and potentially put you at risk. Of having, lymphedema. Yeah. Yes, I guess. So, but I did start very, very low. Very low, yeah. But then it did get hard. But then I did get, And I managed to get stronger during my chemo. Amazing. Yeah.
I just have one more thing to ask about, which is radiation. Yes. And so, what are the considerations there? Like, what happens when someone has radiation treatment? Is it sore and red? In my brain, I'm picturing a sore red place where the radiation goes. Yeah. Yeah. Okay.
It is an absolute spectrum of how people react to radiation. It really is individual. And I'm still salty that I was told by my radiation oncologist that it would be a walk in the park after chemo. And so that was my experience. But there is a range. So some people get very, very little symptoms, very little, they don't get pain at all. They might not get any fatigue. So some people, it is a walk in the park. But then for other people, they might end up with a lot of pain, redness, even broken skin. So the general experience is that the first 10 doses might be okay, and then after 10 doses it starts to accumulate. I had 25 doses, but I know people that have had, you know, like 40 plus doses, so it's 5 days a week, you're going every day. And then when you finish, you go, yay, I'm finished. And then I was given a little booklet saying symptoms will peak at 7 to 10 days. I was like, no.
Okay. After.
Yeah. So exercise is recommended, but you do need to respect pain over the radiated area. So some people manage to do weights through the whole radiation and beyond. Just my experience was after about, 11, 12 doses, everything caused that radiation pain. So then I just did cardio, bike riding, exercise, bike, walking. Yeah. So,
gosh.
But you're not meant to sweat. I had okay.
Brisbane.
And it was nothing. It was like October.
Yeah, no.
It was stinky hot. So I walked in the evening. Yeah.
Okay. Well, that has given me many things to think. Is there anything else you wanted to add that I haven't covered before I ask you to just recap your main points?
I think half the population will get cancer by the time they're 85.
God, that's a hectic statistic.
Yes.
Eh?
Yeah. And we know that exercise is a powerful medicine in cancer care, and we just need more exercise health professionals to be offering their services along with fitness professionals. Yeah. So there's it's 2019, it's called Exercise Guidelines for Cancer Survivors, you know, an international consensus statement. It's got the word round table in there somewhere. Yeah. I can't get the whole word out. But it actually goes through the role of the fitness professional and the role of exercise health professionals. Yeah. So the higher risk people, you know, needing to be seen by, like your physios and exercise physiologists, physical therapists, and then the fitness professionals seeing lower risk patients, but having respect to the impact of chemo or radiation. So I think if anyone is a fitness professional or a physio or an exercise physiologist and somebody comes in and says, I've just been diagnosed with cancer, you just need to say, right, you need to exercise. Yeah. And you just go off, you do your reading and you support them through Be like Emma McRae, my powerlifting coach. Is
she back from maternity?
Yes. Yeah,
so she is. Are you back with her? Or is it that the time's ended or?
No, because I've kind of started learning some Olympic powerlifting stuff. So yeah.
It's so funny. I told you this last time. I used to follow her randomly, and if she's listening, that's hilarious that she'll hear this little story. I used to just follow her, and then I started following you, and then Brisbane's so small. Yes. I'm like, they know each other. Yes. But it is so just like heartwarming and refreshing to hear about these people like her doing such awesome work.
She did an amazing job. It was so funny because she's 20 years younger than me. And like on my chemo, when I'd come to her and I'd be quite fatigued, she'd say, you have to send me a text message when you get home so I don't worry about you.
We need more.
She was so lovely, and so good at managing pain and And
I guess like the place you work is awesome for that. And I guess I like to think that here at Blue Parallel where I am, I like to think we've got a similar thing going. Like we've got a bunch of really good coaches that coach various different things outside, and then there is myself like a physio, and there's some EPs working here as well. So there's a team there that if you're working with someone with cancer and something comes up and you're not quite sure, you might be able to say, maybe I'll just refer to the EP or for a physio or for just a session to kind of see what modifications we might be able to do around. But I definitely think, personal trainers as well and strength coaches, they have so much experience exercising with people. They are qualified to do, like you said, the lower risk client. Yeah, that's right. I think you said last time the stat was that only 8% of cancer survivors meet exercise guidelines, which is less than general population. So we definitely need to try and get the word out more. Yes. I have told my clients about it, but some of them say, one of them at the moment, she was saying how her husband's going through chemo and he's had so many rounds and his heart is just too weak to sort of handle it. What do you do then?
Well, somebody like that, it'd be great for them to be seen by an exercise physiologist or a physio with experience in cancer care.
To me, that's like, ex-phys.
Yeah.
Unless you're one who has extra knowledge on cardiac, which you do.
Yeah.
I don't.
Yeah, that's right. Yeah. I mean, of course, you got to, follow what the oncologist says, but like the targeted therapy I was on, one of the big side effects is cardiotoxicity. So I was in heart failure for a while, but I still exercised.
Yeah.
But with I got guidance from the exercise physiologist who's a cardiac expert in my place. So I just he just gave me specific advice, but I kept exercising.
Yeah, and I think that's one point to like seeking out the experts. Like we can't do all of it, so it's like I know what my expertise is.
Yes.
It's definitely not lymphedema and it's definitely not cardiac.
Yeah.
But I could still work with a cancer survivor, but just bearing in mind. Yeah. And like I said, I have had so many women coming for my bone density, and it should be men, but it isn't. But it happens to be women coming for my classes who've had cancer previously, who are presenting now. So it is interesting how much it actually comes up once you're aware of it and you're thinking of it. I realise like so many people have had it. Yes. Like you're saying, once maybe 1 and 2.
Actually, you bring up a really good point about bone density. So it is, women who have been put in early, chemical menopause, but also things like prostate cancer or testicular cancer. Yeah, if they're put on hormone blockers as well, it ruins their bone density. The chemo itself and radiation are not good for your bone density. And I actually had somebody message me, a man, saying that he was pretty darn annoyed. He didn't know that his treatment impacted his bone density. Like, he didn't even know it was a thing that he should be looking after. And then he fell off his bike, and I can't remember what he broke. Yeah. But he broke something, and he was pretty darn annoyed. So, it is men too can have their bone density impacted.
So we need to get the word out. So hopefully this podcast has done it. So I guess, do you want to just say what you think the main take-home points are?
Okay. Exercise should be embedded as a part of standard cancer care.
Yep. That's it.
And it's hard to do.
Yeah.
And the ideal would be for somebody to be supervised by an exercise physiologist, physio, or a fitness professional.
Yeah. And I guess the things that really stood out to me is the fact that, exercise, bone density and muscle mass. The fact that having more muscle mass might mean you can tolerate more chemo. That's huge to me. The fact that exercise might suppress tumour growth. Yes. And the fact that exercise might deliver more chemo and radiation to the tumour. Yes. That stuff to me is mind-blowing. I feel like almost no one knows that. Yeah. So, for sure, we hopefully can tell as many people as possible, and it gives them some hope in this space.
That would be amazing. And just the very, very last thing, which we haven't dived into, mental health. It reduces anxiety and depression, and it gives you a feeling of control.
Okay. Perfect. Well, thank you so much, Helen, for coming and talking about this with me. I feel like every time I talk to you, I get more info and feel more passionate about it. So again, Helen works at UQ in Toowong.
UQ Healthy Living Toowong. Yeah.
Which has program for...
Well, I have an awesome colleague, Rochelle Cornish, who has passionate about oncology exercise. It's been her burning career passion, and she's got extra training.
Okay, amazing.
Having...
Myself, like I said, I work at Below Parallel in the Valley, and we have a great little team here, and we have an awesome gym space. So just something to consider. But if you're not in Brisbane, there are, I'm sure, many EPs and physios out there who are going to offer the same sort of service.
Yeah, and if you're in Australia, Medicare gives you those 5 allied health sessions per year. Yes. So if you can't find somebody local, there are exercise physiologists and physios who do online consultations.
True, and have you got something online?
Yes. Oh, no, not at the moment.
Okay. Watch this space. Thank you for tuning into the FKB Physio podcast. My previous episode was with Jeff about ACL, so if you want to listen in on that episode, then it's the episode just before this one. Thank you.
Thank you.